Good morning, everyone, and welcome to Sexual Health Education as Rape Prevention. My name is Blyth McConaughey, and I am the sexual assault advocate at the Center for Awareness of Sexual Assault at the University of Wisconsin-Eau Claire. And speaking with me this morning, I have Janel Hebert, who is a public health nurse for the Eau Claire City County Health Department, Abby Hinz, who is also a public health nurse for the Eau Claire City County Health Department, and Amanda Schumacher, the Sexual Assault Program Director for the Family Support Center in Eau Claire and Chippewa counties. So some of our objectives for our presentation this morning. We want to learn why sexual health education is a rape prevention tool. We want to explore the importance of framing sexual health messages to empower populations and individuals. We want to increase comfort in utilizing empowering sexual health messaging to prevent sexual violence. And we want to understand how to create an environment that exemplifies these ideals. So just getting started this morning, how can sexual health education help prevent sexual violence? We want to start with the definition of sexual health as determined by the World Health Organization, which is a state of physical, emotional, mental, and social well-being in relation to sexuality, but not merely the absence of disease, dysfunction, or infirmary. And the second part of that is that sexual health requires positive and respectful approaches to sexuality and sexual relationships, as well as having pleasurable and safe sexual experiences, free from coercion, discrimination, and violence. So the goal there is to not only have a safe and happy sex life, but to be enjoying your sexual health as well. For sexual health to be attained and maintained, the sexual rights of all people must be respected, protected, and fulfilled. So everyone in the sexual relationship is consenting and happy, and everybody is enjoying their health and is feeling good, not just not having violence. So some ways that people have approached violence prevention in the past there's just a couple of things that we want to touch on. People in the past have tried to change behaviors to prevent victimization, like saying, if you do this or don't do that, then you won't get hurt. Or thinking about offense versus defense in relationships. I think historically, women have been coached to be on the defensive, or that women are the weaker sex and men are more dominant. It's the stereotype that women are inferior. And then some aspects of sexuality are dangerous and must be avoided. And with that, we're thinking about people in violence prevention teaching that there are taboo practices, such as anal sex, that should be avoided in order to stay safe. These attitudes placed healthy sexuality education at odds with sexual violence prevention. And sexuality itself was often treated as a universal threat with inherent power disparities. So some ways that we want to approach violence prevention now in 2020, just some different ways to attack it. We want to remove the obligation for prevention from potential victims. So changing that behavior piece. We're no longer saying, don't do this or do that and you won't get raped. We're putting the obligation of prevention on the potential perpetrator. We're talking more about partners in relationships supporting each other's well-being. So not just women supporting men or men supporting women. We have no weaker sex or offense or defense. Everyone is equal and equally supported. And an emphasis on consent, care, and mutual satisfaction. So everyone involved is consenting, is adult, is enthusiastic, and is enjoying their sex life. Some other common themes that the Centers for Disease Control have used for sexual violence prevention: the promotion of social and emotional health, empathy, and connectedness. So thinking about communities being socially and emotionally healthy, empowerment-based frameworks, and intentional teaching of healthy, safe dating and intimate relationship skills. And now I'm going to pass it on to Abby, who's going to talk a little more in depth about that. I don't think we can hear you, Abby. I think you're on mute. Still, nope. Can't hear you now. Uh-oh. Okay, Abby says she's gonna quick jump up and go to another office. Thank you everyone for this little tiny technical glitch.
Unmute. All right, I'm here. Can everyone hear me okay now?
Now we can hear you.
Perfect. Thank you. Okay, so next I'm going to highlight the National Coalition for Sexual Health and 5 action steps that they have for good sexual health. And these really do parallel the CDC's themes in preventing sexual violence. This positive messaging is really meant to empower people to have good sexual health and to develop those healthy relationships and healthy expectations, because we know that good sexual health messaging and education is based on a positive, empowering, and a social context. And this is really crucial to preventing sexual violence. So the principles of healthy sexuality and education and sexual violence prevention are clearly linked, which is really necessary to acknowledge because we know that rates of sexual violence in Wisconsin are serious. According to the 2019 Wisconsin Youth Risk Behavior data, 24% of young people answered that they had experienced some type of sexual or dating violence. And for this question, we know that there are other groups too that had even higher rates across Wisconsin. So people that self-identified as female, LGBT, having a physical disability or medical condition, those that use special education services, and those that identified as being food insecure had even higher rates of answering yes to sexual or dating violence. So we know that sexual violence is happening. Let's talk a little bit more about why sexual health messaging is so important. So currently, sexual health messages are often incomplete, unrealistic, or disempowering. So we have been able to work with different groups in the past. One of them was the UW-Eau Claire Women's Gender and Sexuality Studies capstone. And this group of students worked to assess what their peers and other young people experienced with their sex ed. So what they commonly found was that 5th grade and then 7th through 9th grade were the most common times for sex ed in the academic setting. And then the most frequent topics that were covered were STDs, abstinence, birth control, pregnancy, menstruation, and anatomy, but often this anatomy was either classified as male or female, and that was based on the sex assigned at birth, and then consent. And then just a little side note on anatomy, is that we actually had a group of high school students that we were working with that told us that in their anatomy lesson in sex ed that the clitoris wasn't even included, and it was actually on the diagram, it was crossed out, and this teacher didn't even acknowledge it. So that's just kind of one anecdotal example of how sex ed can often be incomplete. All right, so going back to consent, this is a different survey done by students at North High School, and during one of their lunch periods during Sexual Assault Awareness Month, they surveyed their peers and asked about learning about consent and healthy relationships in class. And so while a lot of them said that they do recall learning about it, close to all of them said that they thought that consent and healthy relationships should be covered more thoroughly in class. And then back to the other assessment that was done on sex ed by the university students, what they found as the least frequent topics covered were the spectrum of sexualities, cultures, and genders. And then these students also found that 21% of the people surveyed thought that their formal sex education in school didn't actually fully prepare them for their adult sexual experiences. And so we know when that happens, a lot of people go to the internet, which can be a really big, scary place to find reliable and accurate information. And then also almost all of the students found that people thought that if there were better sex ed, it would create an environment of better sexual communication. And we know that this is also a critical piece to preventing sexual violence. So these are just a couple quotes from that survey, and they highlight how their sex ed had been unrealistic, negative, and outdated, and how this could be really disempowering for young people. So now we're gonna have Amanda jump in to a little bit more about messaging around sexual health.
Yeah, thanks, Abby. So in summary, I guess the main takeaways from current prevalent forms of sexual health education really include a focus on anatomy that's very narrow and includes binary definitions. This presumption of heterosexuality, of cisnormativity, a disregard for lots of intersecting cultural factors, that prohibition framework that we talked about a little bit earlier, or offense versus defense in terms of STI, pregnancy, and sexual assault prevention. And then downplaying even the existence of pleasure-focused sexual experiences for all partners. I think Abby's anecdote really illustrates how that can be the case sometimes. And denial of casual sex as a practice. In other words, I like to roll out this GIF from Mean Girls. The bottom line is, don't have sex because you'll get pregnant and die. And of course, that's a little bit reductive, but we still need to figure out how we can look forward to more empowering messaging around sexual health education, and then in turn, concurrently, sexual violence prevention. So when we're framing sexual health messages and trying to do so successfully and comprehensively, there are a few current realities that we should keep in mind instead of trying to pretend that they don't exist or working against them. And I just want to emphasize that that's not the same as placing a positive or negative value judgment on these. It's just simple acknowledgement. So the first of these is that technology can play a big role in today's adolescents' experience of sexuality. Porn is readily accessible, and whether they're intentionally doing this or not, like Abby mentioned, it might be used to fill in some of the gaps of information that isn't taught in formal sex education curricula. However, as Abby also alluded to, we know that there aren't exactly any quality controls in place that are going to guarantee the accuracy of this information, or we certainly don't know in balance whether the messages people are getting from porn are necessarily ones that would support healthy relationships. Dating and hookup apps, in theory, they've expanded the landscape of possibility for people seeking relationships, and that can include functions that allow people to screen prospective partners more quickly and less potentially harmfully than in-person meetups. But we also know that these snapshot profiles can be really reductive, they can be dishonest, and they might also normalize judgments that are based on oppressive ideals. Then there's sexting, and we'll talk a little bit more about this later on. In theory, this could be used as a safer sex option in terms of pregnancy, STI prevention, but there can definitely be challenging consequences for adolescents who use technology for intimate conversations. And these consequences are both legal and social in nature, as we'll also talk about a little bit more later on. So a second current reality is that casual sexual encounters or hookups are really commonplace. There's been widespread conversation about so-called hookup culture, but much of it, including I feel like the term hookup culture, has kind of a disparaging tone. And it suggests everything from like that inherent danger that Blyth mentioned up front to just emptiness. And when someone's sexual practices are discussed in this way, it tends to provoke this knee-jerk, kind of almost combative response from someone. However, there have been, when we look at research, there has been a lot of disparities reported in overall sexual satisfaction from hookups. Specifically, women who hook up with men have indicated that there's a perception of like diminished focus from their partner on their pleasure during a hookup. And I guess the speculation there is that if the relationship essentially ends after the hookup, then, you know, due to kind of socialization and cultural factors, men might not feel that obligation to care as much about their partner's satisfaction. But circling back to the idea that hookups, the widespread idea that hookups are inherently unsafe, in addition to kind of prompting people to tune out that messaging that's perceived as judgmental, it can also lead to less openness about sexual practices, and that can close the door on a lot of education that could potentially enhance people's health and well-being. Another reality is that people of all genders and ages have sexual experiences basically with other people of all genders. We talked about previous examples from the student surveying data that demonstrates there's a real lack of accessible, healthy sexuality education for LGBTQ+ adolescents. And even parents who are affirming of their LGBTQ+ children might not know exactly how to talk about healthy sexuality and healthy relationships with them. There's also the reality that rejection, familial rejection, is significant among LGBTQ+ youth populations. And so they might not be able to be as open about dating and sex until they're no longer so reliant on adults to provide for their basic needs. Then finally, the general lack of visibility and representation, or only being exposed to negative messaging about LGBTQ+ sex and relationships, that can lead to this internalization of harmful myths and stereotypes. Finally, we would be remiss if we didn't mention the impact of the Me Too movement and other prominent news stories that have to do with sexual violence and consent and healthy and unhealthy relationships. Many of the high profile cases that we've seen are kind of held up as like really good jumping off points for discussion, but they can also really re-traumatize people who have experienced violence. So for example, during the Justice Kavanaugh's confirmation hearings, we saw a really sharp increase in calls at our agency from individuals like of all political persuasions whose old trauma was really activated by the tone of the national conversation. Also, a lot of people are now recognizing how they themselves have perpetrated harmful behavior in the past. And, you know, some of them may not want to continue to harm others. However, there's this lack of a clear path for accountability for those individuals. And lastly, much of the publicity that surrounded experiences of sexual violence or these high profile stories tends to neglect and, you know, therefore invalidate the experiences of marginalized voices. And the irony here is that The Me Too movement founder, Tarana Burke, has been really explicit from the beginning about her intention to center marginalized communities. And specifically, her initiative was intended to uplift the voices of Black women and girls, which we aren't always seeing or even frequently seen reflected in the discourse. So I'm going to turn this over, I believe, to Janel.
All right. So, now that we've talked a lot about all these different things, how do we really bridge this gap? How do we get to this place where we're promoting mutual satisfaction and pleasure, and including all spectrums of gender, and then also recognizing that not all relationships are heterosexual? So we're going to talk a little bit about integrating education and prevention messaging in everyday practice. So we can start by taking a little advice from the Netherlands. So unlike the US, sex education is required and starts at a very young age in the Netherlands. All genders in the same room, learning the same information together. I mean, what a concept, right? By doing this, there becomes really this comfort in talking about what is going on with their bodies. Dutch teens report more positive experiences with sex and they have fewer sex partners as compared to US teens. Compared with the US, Holland has a lower rate of teen pregnancies and STIs, as well as much higher gender equality. So forming partnerships with local resources, providers, offers adolescents really a great network of support. So one really good example is having a sane nurse from a local hospital or an advocate present when you're talking about sexual assault. This really helps provide consistent messaging and really enhances the credibility of what you're speaking to. Also, they really know that who you're talking to or who, when somebody comes in the room and they are actually an advocate or actually a sane nurse, that could possibly be somebody in the future that they would be talking to. So it's really like that warm referral. So how this may look. This may look like using evidence-based curricula, safe dates. I know that you guys had talked about that before. The 3 R's, I think that was in yesterday's one of the speeches as well, or one of the presentations. Those are just really a couple examples. Also providing an environment that supports social emotional learning by building confidence, support understanding, really supporting your strengths and weaknesses, collaborating with others, navigating social situations, develop strong relationships, and make better decisions. So examples of that may include like modeling self-talk and affirmation, and also working in teams and really just setting goals. So another helpful guideline is not assuming a level of knowledge. Give them all the information that they need and let them determine how much or how little they want. This really applies to both information you think they should have and kind of their age as well. So just give them all the information. Also reserving that judgment. We learn our biases and we can unlearn them. And really, how do these biases that we have sometimes, how do they influence our interactions with students? So we really need to think about that a little bit, and how can we change that? And how do those biases that we have influence our expectations for students as well? So yeah, acknowledging the certain definitions of health and safety are relevant or relative. So be truthful and factual. So really know and tell why. And this is again why that interdisciplinary team is important. And also just kind of moving away from that scared straight mentality and kind of the fear of getting in trouble. Just kind of moving away from that. So Blyth is going to talk a little bit more now.
Okay, now I'm unmuted, thank you. Just some further guidelines. Keeping in mind that many adolescents have already experienced violence and can be especially susceptible to shame. So that is often something to consider when talking about survivors and talking to survivors. Many survivors may seek to protect themselves by shunning sexual behavior altogether or taking back control of their bodies and their sex lives by pushing boundaries. So one of those two extremes could be occurring. And also, fun educational activities can feel really trivializing to survivors. There was one example I wanted to mention that I've seen in classrooms where we put glitter on our hands and then we shake hands with everyone in the classroom and then we see how our glitter spreads across the room. And thinking of that in terms of an STI, right? Like that just kind of minimizes the seriousness of it and it perhaps doesn't take it seriously enough. Some other things to think about when talking to survivors about healthy sexuality, asking questions like, do you want to have intimate relationships in the future? Have you had healthy or enjoyable or satisfying intimate relationships in the past? And what does that look like for you? What is a healthy sex life from your perspective? And what are your expectations for a healthy intimate relationship? How did what happened to you in the past differ from your ideas about what is healthy? So just asking them to kind of interrogate their previous experiences and what they're hoping for in the past or in the future. So let's talk a little bit now about how exactly we would do this. Let's practice a little bit, shall we? We're gonna toss out some scenarios and talk about some ways that these could potentially be responded to, okay? So here's our first scenario that we want you to think about. 14-year-old Savannah's mom made an appointment for her at the clinic following some recent concerning behaviors. Savannah was sexually abused by her uncle when she was in elementary school. The abuse was reported. Savannah's uncle faced criminal charges, and Savannah went to counseling for several years. Now her mother reports Savannah hardly ever even mentions the incident involving her uncle. But recently, Savannah's mom discovered boys from school have been requesting nudes, and Savannah has been freely sending them. The school resource officer has threatened to charge Savannah with distributing child pornography if she doesn't stop. Savannah's mom is sure that this behavior is related to Savannah's past abuse and is a gateway to even more dangerous decisions. Savannah, however, thinks that all of this is no big deal. So, Amanda, what would you do?
Well, there are a few potential ways we could respond. And before I share some of those, I want to just stress that while all of these scenarios are based in actual experiences that we have had in the field, all the names and identifying information have been changed because we really value, of course, the confidentiality of the people that we work with. So in Savannah's situation, one option that we might be tempted to utilize is just printing out a copy of all those statutes that those laws that you think Savannah might be violating, and really talk to her about the worst case scenario legal consequences for her action. Again, try to scare her into making choices that you feel are best. We could also inform Savannah that because she was sexually abused as a younger child, maybe she isn't capable of making healthy choices for herself and that she should just defer to her mother's judgment. But in each of those first two examples, we really see a lack of agency, a lack of empowerment, and obscuring some of the realities that are going to impact Savannah's actual life, which is her own. So an approach that we might suggest is just talking to Savannah really honestly and directly about both her rights and her responsibilities when it comes to sexual health decision-making. We can affirm her feelings without endorsing her choices, and also present the range of options, really stressing autonomy and empowerment.
All right, so here's another scenario that I'm gonna read. 17-year-old James is a participant in a healthy relationships class you are facilitating. In class, you've been discussing features of caring relationships as well as red flags that could signal unhealthy or abusive relationships. One potential red flag is unwanted non-consensual physical contact. James raises his hand and mentions that he and his boyfriend, who is also 17, both like to playfully wrestle and fight, which sometimes leads to sex. The other students in your class giggle nervously when he says this. You suspect other students' discomfort may have to do with James mentioning the gender of his dating partner. Even though he and a handful of other students openly discuss being LGBTQ+, and your classroom learning agreements stress respect for others' identities. I want to know if this kind of thing is still not okay, even if we're both into it, James says. Go ahead, Amanda. How would you respond to this?
And I have to say, this is a scenario that I encountered when I was teaching a healthy relationships class. One response that someone might be inclined to make for James is that, telling him that this is just not an appropriate question to be asking in class, but that you'd be happy to talk with him afterwards. And I don't think that any, shame or embarrassment necessarily motivates that response on the educator's part, but it could communicate shame and embarrassment to James. I think the fear really is that James has disclosed something that is potentially, still taboo or subject to oppression in our society. And judging from the reaction of James's classmates, we might respond in this way in order to try to protect James. We can also be very hardline and say, violence is violence. There's no special rules just because you're both males. Of course, that runs contrary to the way that we have framed ideas about consent so far in healthy sexuality education with these youth. So instead, a good route to take would be to affirm James's question as a reasonable one, and then maybe for class discussion to kind of expand the lens of what we're talking about, so everyone can apply it to situations that they may encounter in their own experience, and can figure out a good screen or good tools to identify if an experience is mutually wanted and consensual. And so then all students, of course, should be offered the opportunity to have more situation-specific conversations with you or with another professional outside of class.
All right, so our last scenario is one that I think a lot of us have experienced, and I know both Janelle and I for sure have experienced this multiple times. So imagine you're staffing a table at a table fair for your workplace. The display includes free condoms and lube. A group of teens approaches the table and one of them picks up a condom and says, "Oh my God, you need some of these, dude." The friend laughs, says, "No, man. You only need to worry about that if the girl is really slutty. If someone asks me to use one, I'm like, no way. Do you have a disease or something? Because I know I don't." And they usually just give in after that.
All right. I feel like, and everyone can confirm this, this is probably the scenario that was the most potentially challenging for even us, because you haven't had time to build a relationship with those young people, and there's probably a good chance that you're never going to run into them again. So you have a very short time frame to make a call about how to impart some good messaging without overstepping. So we were all said that maybe a comfortable option would be pretending like we didn't hear their comments and just smiling and nodding and saying, you know, take whatever items you want, and just hoping that they would move along as quickly as possible. On the other end of the spectrum, we also thought that this was like a potential option we could see ourselves turning to. So telling the teens, that is an awful way to talk about your dating partners. If you can't be more mature, I wouldn't be surprised if no one wants to have sex with you. No one wants to date you. Again, while that might be our immediate response to hearing some of these comments, we have to remember that, you know, attitudes aren't formed out of thin air, that there's a lot of cultural kind of detritus that has influenced these teens to reach the point that they're at. And also maybe what they're verbalizing to their friends in that social setting isn't necessarily something that they truly have taken to heart. So realizing we do have this opportunity to plant those seeds and maybe offer an alternative message. So instead, we could offer using condoms is one way people can show care for their own health and the health of their partners. Here's some more information on condoms. Let me know if you have any questions. It's not belaboring the point. Hopefully it will not be super uncomfortable for the young people, and that positive framing and lack of judgment, lack of a call out could encourage them to actually engage with those messages as they move on in life.
All right, thank you, Amanda. Hopefully you all can learn a little bit or have taken something from those scenarios. So now we're going to talk about creating affirming environments. I know this is something that we have worked on quite a bit here at our clinic at the health department. Really, we can set a welcoming tone for conversation by being intentional about our environment in our clinics, in our classrooms, in our workspaces. Also, just having sex positive messaging on posters and handouts, images representing diverse populations, forms that are inclusive. I know we really had to take a second look at the forms we were using because they said female, vaginitis. I mean, they were very, you know, male or female, and we really needed to stop and take a look at that a little bit more. Also, what else was I going to say? Oh, Abby's going to talk a little bit more about the classroom.
Yeah, so all of us work a lot with young people and work in a classroom setting, and we've come to learn that it's really good to partner with the youth to make these group learning agreements when you go into a classroom, so they have that buy-in and they feel that they can actually share and feel like they're in a safe space to share. So creating those group learning agreements together is a really good positive way to kind of start that experience with the youth. We do bring some learning agreements to these groups. One of our favorites, because it tends to get the attention of young people, is "Don't Yuck My Yum." It's kind of a fun one that we've borrowed from other adolescent health educators that we work with. And it's really just about, don't be judgmental. We're all into different things. We like different things, and that's okay. And we have to respect that of other people. And then lastly, using inclusive language and diverse representation in instruction. So what this could look like is using gender neutral terminology and terminology that doesn't reinforce heteronormativity. So saying they instead of he or she, saying dating partner or partner instead of saying boyfriend or girlfriend. And then another thing that we've also tried to practice in our classrooms is when we are working with a group of young people, we try and make sure that the content is adapted so that it's appropriate and it kind of reflects the diverse experiences. So one example is with the Eau Claire Area Hmong Mutual Assistance Association, we really worked with the staff there to change things so that it felt real to the young people, and that included changing names and scenarios so that they really saw themselves reflected in the lessons that we were doing.
So other workspaces, and I would even venture that any other workspace can also take steps to promote healthy sexuality and healthy relationship messaging. One great way to do that that we have tried to reinforce with other anti-violence agencies, such as the ones that Blyth and I work with, is creating an inclusive non-discrimination and anti-violence policy that applies to both staff and clients, and then making sure that staff and the folks that we serve are familiar with the non-discrimination policy, the inclusivity policy, even posting that prominently, whether that's in our physical space, or we can also talk about how we utilize virtual spaces like social media. So ensuring that inclusivity and non-discrimination is really emphasized across the board. This is something that I would recommend for anyone, again, regardless of what kind of environment your workspace is. If we want to see positive outcomes for people who are in intimate relationships, so Blyth and I work with people who have experienced intimate partner violence and sexual assault already, we need to set a tone of respectful communication and healthy boundaries, even in our interactions, or maybe especially in our interactions with our colleagues and coworkers. So having that standard be enshrined in our organizational culture is really important. It's kind of astonishing how sometimes organizations might not always practice what they preach. So we know that in order to encourage the people that we're working with to exemplify these ideals, we should make a point of doing the same. And of course, we don't have the same kind of relationships with our colleagues and coworkers that someone might have with an intimate partner. However, respectful communication can still be made a focus of our working lives in different ways. Finally, all staff should be trained to prevent and respond to violence, and that includes frontline staff who might be answering the phones, people who may have only occasional encounters with the populations that you're serving, because they really do have the power to act as that like envoy to the next person, to the next helping professional who might be able to do some more intervention. So just having those individuals made aware of the potential signs that someone could be in need of help, or how to deal with the disclosure of violence, can really enhance the trust of that person and increase the likelihood that they're going to be able to seek out support for healthy futures. So here we have a couple examples in the following slides of our different workspaces. I'm going to turn this over to Abby and Janel to talk a little bit about what their clinic looks like.
So this is something that we, the condom display, we saw at another facility and really, really liked it. But just to show that we have a wide variety of condoms, we have internal condoms, we have lube, we have dental dams. So really just having things that are available for all different spectrums.
Mm-hmm. Yeah, and so moving on to the other picture, you can see one of the things we like about this is we worked with someone to develop a poster specifically for adolescents about confidentiality, just because we know confidentiality is so important to making a safe space. One thing I'd like to note though is we don't always get it completely right. As we reflect on this poster, both of the people in it look a little sad or worried, and it's not necessarily the positive sentiment we want our patients to have around confidentiality. So like I said, we don't always get it right, but we got to keep learning from it. Another thing I like to highlight is Janel already mentioned that we have lube. And we also have information on lube. And that's, I think, one way that we can kind of bridge some of our conversations around prevention to pleasure, which is really important to empowering people around their sexual health. And then here are just a couple more images that we have, things hanging up in our clinic. And really what we're attempting to do with this is just have images that are inclusive of diverse identities and resources that are also inclusive. So as you can see, we have a room to be safe poster, which we have hung up, and that's specifically from Diverse and Resilient, and it's for people that identify as LGBTQ+. And it's an anti-violence program that we have as a resource that we can provide to our patients.
And an example of an inclusive item in our office in Chippewa Falls at the Family Support Center, in one of our bathrooms, we have a condom dispenser that we received from the Chippewa County Department of Public Health. It was a little bit of a challenge for us to get this. As a domestic violence and sexual assault agency, it's important that we don't make people in the community think that we're providing anything in relation to healthcare. But we were able to kind of finagle this condom dispenser from public health, because we really feel in our office that if we're going to be helping people with intimate partner violence, if we're going to be preventing violence in sexual relationships, that being sexually healthy is a part of that. So we have this very discreet condom dispenser that anybody, the bathroom is for all genders, and anyone can go in there and get what they need, and no one has to know anything about it. And we've made it very clear by labeling it that it is in fact from the health department and it's not ours. So that was our way of just kind of being able to do that, even though sexual health isn't necessarily our specialty.
And another way that we as an anti-violence program have sought to really enhance that link between healthy sexuality education and violence prevention is in some of our outreach initiatives. This one was part of the Eau Claire's Music and Arts Festival, which was a big event for about 4 years, I believe, in Eau Claire that drew real international attention. So that was a wonderful opportunity that we had to not only put the spotlight on our work as an anti-violence agency, but knowing that public events like music festivals often include elements of sexual violence or dubious consent, we wanted to bring in some healthy sexuality education as well. So we did have condoms from the health department that were provided to anyone who wanted one, and they had stickers on them that said we heart consent, and that consent is a vital part of healthy sexuality. We also were able to get some really fun temporary tattoos from the Room to Be Safe program, anti-violence program, which is a project of Diverse and Resilient. And they said, ask a cutie before you touch that booty. Those were a wild success. There was also a photo project that was brought in where people would take their pictures with messages relating to their commitment to healthy sexuality and anti-violence. And that was really a lot of fun as well. We drew participation from some celebrity guests that anyone would necessarily recognize these folks outside of our Chippewa Valley community, but we have members of S. Carey, which is an amazing band. And then our friend on the right here, Leslie, is a photojournalist from New York who's been really enthusiastic about spreading the message about our programming here in Wisconsin. We also have wanted to talk briefly about what a recent community collaboration looked like between our agencies and some others that we have mentioned. So putting the focus on how effective that multidisciplinary approach to healthy sexuality education as sexual assault prevention can be. In April of this year, which was Sexual Assault Awareness Month, we undertook a project that was in conjunction with STI Week for various reasons I think we're all familiar with related to the global pandemic. This was originally intended to be an in-person event where Abby and Janel would answer questions about healthy sexuality from live audience members, maybe even on stage, and play fun games. That went south really quickly, so we had to revise. What we were able to do instead was partner with the city county health departments. So Abby and Janel, as well as Blyth's and my programs at Family Support Center in CASA, and then students from the Women's Gender and Sexuality Studies Department at UW-Eau Claire all came together to create a video campaign that took place during STI Week in April and covered questions that Blyth and I have received from the folks and communities that we have served in the past related to healthy sexuality. And so if we have time, we're just going to take a brief moment to look at a short video. I know we want to leave a little bit of time to get to your questions, but we're just going to give you a preview of the video. So hold tight.
Hi, we are back with another question. All right, Janel, lay it on us.
Here we go. I am a survivor of sexual violence, and now having consensual sex with my partner is really scary for me. I freeze up when my partner does something that reminds me of the abuse, even though my current partner is such a sweet, gentle person. What's wrong with me? Help.
Nothing is wrong with you. It's a normal response to have when you've experienced trauma.
Yeah, and trauma can kind of sneak up on you at any point in your life. I think if something happens to you as a child or as a young adult.
And it doesn't mean that something's wrong with your current relationship either, right?
No.
It doesn't have to have anything to do with them for you to still have those feelings come up. I think that if you have someone you can talk to about it, whether that's a counselor, an advocate, a friend, yeah, or if you can talk to your partner about it. I know that's really, really hard, but it will help bring you closer, but that's not easy. So it's one of those things where it's easier said than done.
Absolutely.
But it's an option.
Really great question. Very good question.
Thanks.
All right, so just the affirmation, I think that seeing a video like that could provide, and the fact that we chose a video format that ended up in the long run being more accessible to more audiences is just one example of ways that we can partner across disciplines to be able to promote healthy sexuality education and anti-violence work in the same breath. Here really quick are some resources that we do recommend, and it really covers a range of ages. Most of them are geared towards young people. I don't know if anyone had something that they wanted to add about specific resources but these are all good places to start if we're looking for examples of ways that healthy sexuality education has been successfully framed in the past. And now I am going to turn it back to Kara, I believe, to see if we have any questions.
Hi. Thank you all for being here today. Thank you for that wonderful presentation. My name is Kara. I'm the Director of Clinical Quality with HCET. So far, the question we've got is that they need the website again for where the temporary tattoos came from.
Sure thing. And I'll add the caveat that I don't know if the temporary tattoos are available, but definitely you can work with the folks at Room to Be Safe. That's ROOMTOBESAFE.org. And they should be able to answer any questions about the temporary tattoos, or they have stickers as well with that design. So really good anti-violence program through Diverse and Resilient.
Great. That was roomtobesafe.org, you said, correct?
Correct. Yep.
Well, that's in the chat for people. Does anyone else have questions? Feel free to use either the Q&A or the chat. Someone commented how wonderful that video was and how relatable you are and how effective that was. I really agree with that. How about, is there a specific website with icebreakers on how to get teens feeling more comfortable speaking on these topics?
So I can speak to that, and maybe we can send out some resources too. So some of the websites that we put at the end of this presentation have really great videos, because sometimes it's not easy to start that conversation yourself, but you can watch a little video. I know amaze.org has videos for all ages on all different topics. I know they have one on porn. They have them on healthy relationships. They really just cover a lot of topics. So that would be a really great one to reach out to if you you think videos would be a good icebreaker. I also know that we have, and I can send the links out to this, there is a consent toolkit that a group worked on from across Wisconsin that has lots and lots of resources, including videos and lessons and graphics that can be utilized to talk about consent. So I can find some of those resources, and we can make sure that we get those links sent out.
And I should
Great.
just say that Abby and I work in public health, and we know we should be social distancing, yes. But her and I mean, we pretty much live together almost, it seems like. So we watch each other's kids and stuff. So even though we're not 6 feet apart,
sorry. And technical difficulties too, yeah. Right? That's just how it goes.
The next question is, where can people find your video series?
So that
a lot of them were all posted on social media. So if you follow Family Support Center on Facebook or the Center for Awareness of Sexual Assault on Instagram, all of those are posted on those two profiles. So please follow us.
I will try to quickly find a link to the Facebook event. Hopefully we will get them all on YouTube very soon. But we had to retitle the Facebook event, Let's Talk About SAM, S-A-A-M, for Sexual Assault Awareness Month, instead of Let's Talk About Sex, because we were running into some filters that were excluding the event. And also one thing that, I don't know if anyone remembers the graphic that we used that our students created of a banana and an orange that were just a little bit suggestive. We thought it'll be smooth sailing, but some of our community partners even found those a little bit too racy. So, you know, you try to appeal to all audiences, but sometimes it's more successful than others.
Okay, we might have time for one more question if someone wants to toss something else up there. And then the last thing in there right now is there a copy of the presentation to review?
I think that there might be a PDF on the Sociolabs platform and the agenda where we are. If not, we can make sure that there is a PDF available so that people can access that.
Well, thank you so much. This was a really, really valuable presentation. You do incredible work, and we are so lucky to have learned from you today. Thank you so much.
Thank
Thank
you.
you.
Thank you.
Thank you.